Hey everybody, this is Lisa Harper, and you're listening to the Not Ready Yet Curating Conversations for the Aging Journey podcast. This is the show that changes the conversations we have with our loved ones about aging and life decisions. Let's have more honest conversations where we speak the quiet parts out loud. Today's guest is Bob Bacheler, Managing Director of Flying Angels. Bob is a critical care nurse with more than 30 years of healthcare experience, including 20 years as a flight nurse. Through Flying Angels, he and his team provide non-emergency medical transport on commercial airlines all over the world, helping patients travel safely and families finding peace of mind. Bob has been an active voice in shaping the medical transport field through his service on the board of directors for the Air and Surface Transport Nurses Association. Bob holds a Doctor of Nursing practice degree and multiple certifications, including the CCRN, CFRN, CDP, and CTH. All of these reflect his expertise in critical care, flight nursing, dementia care, and travel health. He has also been honored as a healthcare hero for his dedication to patient safety and advocacy. Welcome, Bob. Thank you so much for joining us on the podcast today.
Lisa, thank you for having me. It's an absolute pleasure to be here. Boy, I'm almost embarrassed. I'm like, who is that guy you're talking about there?
I think that's part of the fun sometimes is doing the intro with people. I know some podcasts do the intro separate from, but I want to give that warm welcome and almost like you say, a reminder to your accomplishments and who you are. So I think that's great that you said that. Well, again, welcome. And so can you start by sharing a little bit about Flying Angels and what that equals, what that service is, and what inspired you to step into this work?
Well, absolutely. So, in the simplest terms, what we do at Flying Angels is we have doctors and nurses all across the country who accompany people on commercial airlines, Delta, American, United, domestically and internationally. So, for those people who need to be transported long distance, grandma has some dementia and she's in a facility in Florida and family want her to fly up to New York. What we do is we'll send one of our critical care trained registered flight nurses down, pick her up, and accompany her on a regularly scheduled commercial airlines, Delta, American, United, or any of the others, up to where she needs to go. We do a lot of that. We do a lot of spinal cord and traumatic brain injury patients who need to get to the centers of excellence around the country. We repatriate foreign nationals who are here in the U.S. and are in our healthcare system, but want to get home to wherever that may be, India, China, Africa. And we work with the hospital to get the person home. We also work to bring American citizens who may have an accident while traveling abroad, bringing them back to the United States. And our niche in this industry is that we are transporting the patient on a regularly scheduled commercial airline under the care of a clinician the entire time.
Okay. And so for those that maybe aren't familiar, maybe some are saying, what is the difference between medical escort? Maybe some have heard of emergency medical.
Mhm.
Could you give us a breakdown of how those two are separate?
Absolutely. So there are some terrific air ambulance companies, and they're the ones that provide that high level emergency response for critically ill patients. These are the companies that have their own jets that are configured specifically for medical transport. If you just think of it as an ICU room in the sky, but this is just a patient on a regular private jet flying, from where they need to go, usually in an emergency situation, and usually the person is critical. Just like we met at a conference recently, and we both flew on commercial airlines, United Airlines or Delta. Most of us, myself especially, when I'm traveling, I'm flying on a commercial airline. I don't have private jet money. So, if you kind of think of it in that terms, that if you really need that ICU level of care, then a private jet is probably the way to go. The downside is that it can be very, very expensive. Just like if you think about, I want to charter a plane to fly, down to Florida, it's going to cost many tens of thousands of dollars.
Yeah. And
Whereas
so
for, Mhm.
and so for the medical escort, if people have oxygen,
Mhm.
or what kind of scenarios would fall into that category for those listening that are like, I don't know if my mom or dad is qualified to do the medical escort side. What are some of those questions they need to ask themselves?
Absolutely. So, for the vast majority of the patients we transport have mobility impairments. Again, I mentioned we do a lot of work with spinal cord injury patients. So, if you think of somebody who is a quadriplegic due to an injury, they have absolutely zero mobility. They can't move their arms, they can't move their legs. We transport a lot of stroke patients, people who have severe mobility impairments, due to a stroke. Maybe they have hemiparesis where they can't move half of their body, or other traumatic brain injuries. We can transport them. We have the special equipment to be able to move them, lift them, transfer them. Oxygen dependency, as you had indicated, our nurses have oxygen equipment with them. So if you have somebody who has oxygen dependency, we can certainly bring the oxygen equipment along with us. And then there are those folks who have cognitive disabilities, either psychiatric or dementia patients. We probably do about 25% of our patients have cognitive impairments, and the vast majority of our patients, being seniors, usually have some combination of all three of the above. You'll have somebody who has mobility impairment, is on oxygen, and has some cognitive impairment. These are the people we can transport. At the risk of making it overly simple, if somebody can physiologically tolerate sitting in a seat, can transport them. That's it. So again, I'm going to go back to the high level spinal cord injury, the person who's a quadriplegic. They can physiologically tolerate sitting. They're not going to move. They're not going to get up. They can't walk. They can't do anything. But they can sit, and we have the capabilities to get them on a regularly scheduled commercial flight.
Okay, and so like it sounds like vitals are being
Hmm.
monitored at the same time then, because some of these things are not just, if it was just get on the plane and take off, they would do it without care,
Exactly.
correct?
Exactly. And all of our staff are our staff. They're our employees, are again critical care trained registered flight nurses. So we are, the folks that we have as staff, may in many cases, may be, more qualified than a person might need. But as I always like to say, it's better to have somebody more qualified than less qualified.
Oh, 100%. If somebody's like, oh, I think they could do it. I think if we got them to the airport, they would be able to do it. Where does that patient safety and advocacy, what do you want listeners to hear that is that kind of like an insurance policy for using your services?
Well, the question I'm understanding is, does somebody want to send the person by themselves, or do they just want to try to transport them by themselves and then just hope and pray that nothing bad happens, versus sending a trained clinician, somebody who knows the airports. Our nurses are flying all the time. They know how to navigate the airports. They know how to navigate airplanes. They know what the policies and procedures are. Most people really don't fly that often. Maybe they'll fly once or twice a year on vacation. So they're really not that attuned to, what's going on at the airport, what ticketing policies are, what the procedures are, what's the latest TSA, system going. What are they preventing now? What do you need to know when you go through TSA? What do you need to know when you get on the gate? What do you need to tell the airlines, to get on a plane and make sure that you have a smooth journey? So with us, not only are you bringing, you're hiring a clinician to fly with your family member, you're also hiring somebody who knows the airport system. And our service is a bedside to bedside system. So the family will tell us, hey, my family member is here in a facility or in a residence, say, let's say in Florida, just as an example, and they're in this hospital and they're in room 402, and we want them to go to their residence, in Newport, Rhode Island, and this is the address there. And our service is literally bedside to bedside. We'll arrange for everything. We'll coordinate with the hospital staff for whatever clearances are needed. We'll coordinate the ground transportation to get them to the airport. We have an in-house travel agency, so we control all the ticketing. We do all the booking, and this way, we can monitor the tickets and make sure we know what's going on. Now, we do fly our patients first class when we're traveling, first class domestically, business class internationally for comfort. And also with our cognitive impaired patients, it also decreases anxiety. But basically, it's one of those, not only do you have a nurse who's flying with the patient, you also have an entire team backing up that nurse, that if something happens, if something changes, there's a whole team support to make sure that your loved one gets to where they need to go.
I was thinking because, like, as you were describing the logistics of it, and like, I would say there's a lot of hidden challenges
Hmm.
that, I mean, just anyone trying to do it, like you say, the airline policies changing, any kind of medical clearances,
Hmm.
equipment that's allowed, and just even the fact that you're from bedside to bedside. I mean, that just is a peace of mind that I don't think you can have otherwise, right?
I agree.
Yeah, yeah. You said, I think in another interview, I heard you say that you feel that the role is about preventing emergencies and and not reacting, right? Not having one occur. And I know that we are all, we're none of us are in control of everything, but if you take this journey with flying angels, that's it's a preventative measure to make sure that your loved one arrives safely to their destination.
You took the words right out of my mouth, and that is something that I do say quite frequently, that our nurses are not necessarily there primarily to react to an emergency. Our nurses are there to prevent the emergency. This is one of the reasons that we are monitoring vital signs. We are monitoring a patient throughout. We're monitoring their blood pressure. We're monitoring their glucose. We're monitoring their oxygen saturation. So while somebody may not think they're going to have a problem at altitude, it's one of these, if our nurse is monitoring that person's oxygen saturation and it gets a little low, it's better to just give them some oxygen than wait for them to start having some trouble breathing. That's just one of the examples of patients' emergencies that we want to prevent. There's a lot of things that you can prevent if you're proactive.
Yeah. And so when flying globally, I mean, even domestic, I feel like, my brain is going, there's connections, there's navigating an airport, one or two, even in between your,
Mhm.
departure and arrival. And so you guys are there every step away, every
Ev-
step of the way.
every step of the way, from the moment the nurse picks up the patient at the facility where they are till the moment that the nurse hands off care at the destination where the patient is. They're under our care the entire time. And again, it's not just our nurse. The nurse is the one who is physically there on site, but it's also the entire team. It's the travel department behind. It's the coordinator who are tracking the flights. In many cases, if there's a flight delay, our travel team will know it before the nurse does and can be proactive about making any changes that are necessary.
What's the time frame that families usually find themselves in when saying, "Hey, we need to schedule this, we need to make these arrangements." What's the best practice for them to contact you? Because I know just in my general knowledge of making my own flights, a couple months before you're going to get the best rate. So, what does that? Are people planning for this, or is this something that happens and then they have to do this?
Probably a mixture. To your point, we are flying on commercial airlines. So the more notice we have, the better off we are for the exact same reasons that everybody who buys tickets on commercial airlines knows, as you identified, the further out in advance you're buying tickets, the better the prices are and the more options that you have. The more convenient routes, are often the first ones to get sold out. Now, we do work with people in relatively short notice. In one of your recent podcasts, you were talking about the number of people who fall, and even I was kind of surprised by that. So in these situations, families don't have that luxury of time saying, "Well, I think we'll plan this out 3 weeks in advance." Well, if grandma has a sudden fall, you can't predict, and the family wants to, and she's in a hospital, once she's stabilized, the family want to get her out as soon as possible. So we can often fly on as little as 48 hours notice. It's more a matter of I need the time to get the flights in order, get our nurse to where the patient is, and then they can fly. So, 48 hours is probably on the short side, maybe a little bit less if we really kind of hurry. The majority of our cases probably get scheduled 5 to 7 days in advance.
Okay.
Now we do have cases that get scheduled 2 or 3 weeks in advance for those people who, let's say, your parents are moving, and they say, okay, the movers are going to come in, and I loved your interview with the moving folks there, and but one of the things that came up was the National Association of Senior Move Managers. We're sponsors them. We love them to death, and we do a lot of work with them. Our running joke with them is they take care of the stuff, we'll take care of the people.
No.
And in those cases, we're coordinating something that's say 3 or 4 or 5 weeks out, when they're going to pack up all their stuff, they're going to move their stuff, and we're going to take care of the folks. But for the most part, a week is probably the time frame that we have to work with.
Okay. Yeah, I was just curious because I know that's part of all the discussions I have and for the reason for the podcast is to help people be more proactive
Hmm.
and make a plan and be the narrator of their own story. I was just curious if you have people more making a proactive, they're called to you as more proactive to get closer to family versus the urgent crisis. I know we all struggle with that.
I mean, it's probably a combination of the two. We do have those people who are proactive, and we've had cases where we're talking to families 6, 8 months in advance. Where they say, "Hey, we're going to be moving mom and dad to be closer to us." But from our perspective, a couple of weeks out is fine. So usually we'll leave it as you get closer, and once the plans start to solidify, then you can reach out to us, and we'll be happy to help.
In your team, is everybody a CFRN that
No,
flies with?
not everybody is a critical care nurse with flight training. Not everybody holds the CFRN designation. We do encourage that.
Yeah, yeah. And I know we were talking about patient advocacy and, what does that mean in practice and then especially in air travel?
Well, when our charges are with us, when our clients are traveling with us, our sole focus is to make sure that the patient gets to where they need to go. So, our entire team, is dedicated to making sure that, the safe transportation of that patient. So in that sense, our staff are advocating for the patient throughout the entire transport journey.
Yeah. Can you share on the global scale? I'm sure some of the duration of these trips is extensive.
We're routinely in India, just to pick a country. We're very well tied in with the Indian diaspora here in the United States, and in many cases, it's important when their time comes to an end, they want to be home, where they were born, surrounded by their family. So in many cases, we're working with hospice patients who have decided that they want to go home to India to pass. So these are obviously folks who are relatively sick and uh, are going, pretty far away. Transport to India can be, 24 to, 36 hours, depending on the connections and everything else. So these can be some very, very long trips.
Yeah, and so on that side, on the arrival side, when you're saying bedside to bedside, is the family coordinating the bedside on that? Are they meeting you at the airport? What does that look like logistically?
No, actually, I did a transport just the other day for, unfortunately, a young man who was terminally ill, sudden diagnosis, and they were about 300 miles north of Delhi. So we coordinated with an ambulance company there, and once we landed in Delhi, we took him the several hundred miles north in an ambulance. So when I say bedside to bedside, we're going to pick him up. I picked him up at the hospital where he was in Canton, Ohio. Took him to Detroit, and then once we got into Delhi, took him to small town where he needed to go. And again, we coordinate everything.
That's amazing. I mean, to have that safety and travel like that at a time when, you're escorting someone that is probably in, you know, I mean, beyond pain, their
Hmm.
mental state, their emotional state, and to walk that with them and be their guide through that is pretty amazing. I would think you guys, almost become family in that time.
There are many patients that we have stayed in contact with over the years. I still stay in contact with a couple people that we transported 8, 9 years ago. Checking in, seeing how they're doing. Again, we have young spinal cord injury patients that are in the most traumatic experience of their life as they're adjusting to their new reality. And in many cases, we're able to come in and take a bit of stress off that one piece that we can help with. Excuse me, just to help them in that journey. And we stay in contact, and we follow them on Facebook, and it's really quite touching. Some of the stories we have are really quite wonderful.
I can imagine. I mean, just even picturing that, I was starting to get choked up. Just, like again, you're meeting people maybe at their worst moments
Hmm.
and giving them grace and guidance and security. And I mean, the overwhelm that the families are probably feeling on the other side too, to alleviate that is amazing. I think we're kind of backing into your why, as far as where did you see that need, and how did this become your path?
Well, it's funny. I think earlier on another interview, the term "dude nurse" actually applied. So I'm that prototypical dude nurse. I went into nursing, and I immediately gravitated to the ICU, trauma, burn. I was in those high adrenaline fields that a lot of guys tend to go into, and I really enjoyed that. I really enjoyed Friday night in the trauma bay. That was my happy place. At the time, my wife and I had three small kids, 18 months and 2 years apart. So, we had three kids under 5 years old at some point. And I remember one night, it was Friday night, in the trauma bay, and I mean, things were going to hell. We're throwing towels on the floor to mop up the blood. It was just, and somebody said, Bob, you're so calm. How do you do that? And then I said, well, my wife's home with three kids under 5. I've got the easy job. Are you kidding me? So that was what I was doing for 10 years. And then I wanted to be a flight nurse, as most dude nurses do. The only problem was I live in Philadelphia, and we have so many hospitals so close, and there are just there's a few flight programs, and it's just nearly impossible to get into a flight nursing program if you live in a major area. Not impossible, but it's really very difficult. If you live out in a rural area, it's much easier to, and again, it's always difficult to get a flight nursing position. So I would never want to say it's easy to get into. It's a tough field to get into. But if you live in a remote area, there are more opportunities because there are fewer nurses, and there are more helicopter programs because the distances are more great, and it's much more common to transport patients via helicopter in remote regions. The same reason we get a lot of applicants who are rotor wing nurses. The nurses work on helicopters, and they want to work for us. The problem is they work in remote areas, and our nurses all tend to work near the major hub airports. But that said, realizing I lived in Philadelphia, realizing that I had the Philadelphia International Airport, only 20 minutes from my house. I said, well, this is an interesting way to do it. And I had helped a friend's father fly up to Canada, and he was an honorary old cuss. He didn't like anybody, but I wound up, I flew down to Florida, picked him up, got him on a flight. We're sitting there in first class, and I'm thinking, oh, this is really nice. I've never flown first class. I'm reading Sky Mall, although I think that probably dates myself. But anyway, he's sitting next to me. Halfway through the flight, he stands up, help, help, I'm being kidnapped, I'm being kidnapped. And this was not that long after 9/11, so nobody had a sense of humor on airplanes. So I did what any dude ICU nurse would do. I popped him with a sedative right in his pants. He sat down, went to sleep. I told the flight attendant, oh, he just had a bad dream. Everything's fine. And I said, you know what? This is what I want to do for the rest of my career.
Aw.
So
Wow. I love that. And it was a friend's father, you said,
it was a friend's
started.
father. Yep.
I say all these things, our life experience really does shape us and move us in certain ways. How many years has Flying Angels been coordinating and doing the medical escort?
We've been doing this since 2016. Flying
Okay.
Angels has been in business in its current form since 2016.
We talk about the aging population and baby boomers becoming 65 and 2030, and just trying to get a heads up on actual just society understanding kind of what we're leading into. Are you seeing the need increase dramatically just even the last couple of years for the business?
Yes, I think we are in that demographic wave. I think all of us in who provide services to seniors are going to find our patient population growing, just as as our friends in the Aging Life Care Association, as our friends in the National Association of Senior Move Managers. We were just at the CSA conference, and everybody is just going to experience more opportunities as the patient population grows. And you mentioned 2030. And what kind of terrifies me is, yeah, that's when I turn 65. So, I'll be I'll be joining that cohort
You're in
group.
the last segment, huh?
I am, so
The
I
last
consider myself
qualifiers. Yeah.
the last qualifiers. And as the patients are getting the patient population is getting older, their children are getting older, their children are getting busier, and the patients' children have children. So it's this cohort group, the sandwich generation, that really is kind of trapped between the middle, being caregivers for their children and also being caregivers for their seniors, their parents, which again is one of the reasons that people reach out to us, for our services, because again, they want to move mom and dad up from, where they go, where mom had a fall, or, dad has dementia, and they don't want mom to have to take care of them by herself. They want them close to family. But yet it's rather difficult to, say, well, I'm just going to take off work. I'm going to, leave the kids at home. In many cases, it just makes a lot more sense to reach out to us and say, hey, my mom or my parents are here, and we want them to be closer to us.
Yeah.
And we're certainly probably the best way to go in that situation.
And that's the origin story for the podcast here is the not ready yet part
Hmm.
and helping adult kids find information before there's an urgent crisis, because you are entering a world of a lot of healthcare medical terminology if you haven't been exposed to it. Maybe the patient advocate may be a new term for people listening today. So there's,
Hmm.
and that's what I'm hoping this podcast does is speaks to the adult kids and their commute and they go, oh, what is Flying Angels? I've never heard of that. I didn't even know that existed. I didn't know that that was a support service available even to get my parents here safely. I guess that brings another question. Are you a lot of times flying somebody solo, a solo flyer, or do you sometimes have a couple that you're moving to somewhere?
Probably a mix of both. In
Okay.
many cases, we're just transporting somebody by themselves. It's just our patient. But there are more and more opportunities where we are transporting an elderly couple. Where you may have mom who has some cognitive impairments, and dad who has some mobility impairments. The family just doesn't want to let them loose in the airport system all by themselves. So here we are, taking care of both mom and dad.
Now, does that equal, is it like one person per traveler, or could one nurse, could one of your people fly with both of them?
It really depends on what's going on. It's one of those, we make that decision. In many cases, we want to make sure there's one nurse with one patient, but let's say, if you have a couple, one person, the other person isn't really a patient, doesn't really have any acute needs, he's just along for the ride, if you will.
Yeah.
About a third of our transports, there's a family member going with us, and we're always happy to have family members going along. So if we have an elderly couple and, one person is the wheelchair bound who's on oxygen, and the other is relatively fine, we'll just send one nurse. But, if we have two people who are both have mobility impairments, they both have cognitive impairments, then I'm sending two clinicians to take care of them. We also send two clinicians on these trips, to say India where where we have, 24, 30 hours of flight time. So this way, we can have, eyes on the patient, the entire time and keep an eye on them.
Okay, yeah, those long duration ones. My
Hmm.
goodness, I can't even imagine what that equals. Again, just that peace of mind for the family on the other side. Um, is there anything that we haven't touched upon that you want the audience to know?
Absolutely. One of the things, and I think you touched on this in one of your previous interviews, you were talking about moving, and the term brokers came up.
Mhm.
And this is one of the terrific things about the internet, and it's also one of the downsides of the internet. It doesn't take much for somebody to set up a web page, and they can say, "Hey, we're Bill's Transportation Service," and we can transport your loved one. Uh, whereas we have staff, we have equipment. All the folks are trained by us. They work for us. We do get calls occasionally from people who are brokers. Now we try to just not we don't deal with them when we can. Sometimes they're a little sneaky about it. When they want to transport their friend, they're not going to tell us they're transporting their client. But yet these are just people who have set up a website, and all they're doing is they're just trying to collect fees, being the middleman. Uh, your comment earlier in an earlier podcast about the yellow pages, where people could actually find out, who's local. Yeah, so my advice for people is, if you're dealing with a provider, and again, this goes not just for us, this goes for air ambulance companies, this goes for anybody you deal with. Spend just a little bit of time doing due diligence with any person that you're going to be using a service with. One of the things that warms my heart, and I'm very thrilled about, are the Google reviews we have. We have, I think, just over 320 Google reviews, 5-star Google reviews. People have said nice things about us. We have people who have said things about us on Facebook and Yelp, and these other sites. We have a physical presence. I have an office, in Philadelphia, that overlooks the airport. People, if they want to come down to our office, can come down, and actually see us. There's many sites that I've looked at, and I try to figure out, well, where is this company? It doesn't, there's nothing that would say, hey, we're located in Phoenix, or we're located, in Florida, or wherever the case may be. And again, this is not just us. This is movers, air ambulance, anybody. Now, the problem, there's usually a time crunch. It's not like they have all the time in the world, but you always want to make sure that you're doing that due diligence. Know who you're dealing with. Google the names of the people. Google the name of the person you're talking to. See if they're on LinkedIn. See, what their background is. Google the name of the company and the city where they are. I think that's a terrific way to go, because then you can find out, what have people said about them locally. And if you can't find what city they're in, that's a huge red flag. I'd be very cautious about that. You want to make sure that you know who you're dealing with, and are they the ones who are actually providing the service, or are they just a broker who's just trying to make a buck?
I love how in the moving episode that you're referencing, and thank you for being a listener too, that they were like one of the biggest questions to ask is how many trucks do you have? If you're a moving company and you don't have trucks, then there's an issue. So I appreciate you saying that. Yeah, the old yellow book. At least you knew you were looking at somebody that was at least within your region, correct?
Wanted to be at the top of the list. All they had to do was put a lot of A's in front of their name there.
It was more alphabetical sorting.
Yes, and unfortunately, nowadays with Google, in our particular industry, there are companies spending an awful lot of money on those Google AdWords to get those ads placed up top. It's kind of
Oh,
obscene.
Oh, it's crazy. Yeah, and that's why I say you Google something and you think, even if people go in and Google flying angels right now,
Hmm.
just do, like you say, you have to be aware and present and look through. Because I'm sure there's somebody that's paid some money to who is looking for you, they're trying to grab them. And so we have to be aware of that. You want to make sure you're actually getting Bob and his team there at Flying Angels. So I guess, go ahead.
We have attorneys, and we have standard cease and desist orders, letters that we send out when they are trying to pass themselves off as flying angels.
Wow. Oh my gosh. Yeah, that's just a whole other conversation. I'm sorry that's happening. It's always like the efforts that are taken to ward off some of these things. It's so unnecessary, and I wish we were better humans. I'm hoping now families understand more about the difference between medical escort and emergency medical transport, and how do they go about reaching you, or what's the first step that they need to take?
Well, if somebody wants to reach us, I always tell them the first place to go is our website, www.flyingangels.com. It's pretty simple. We have our phone number is answered by one of our flight coordinators. Not quite 24/7, but during regular daylight hours. And all of our flight coordinators are also critical care trained flight nurses. They've come out of our flight nurse ranks. So, if somebody has a clinical question, they can reach out to one of our flight coordinators and they can have that conversation. Is the person they want to transport appropriate for our service? And, if they're not appropriate for our service, we're perfectly willing and we'll be the first ones to say, no, this is something you're really going to want an air ambulance for, or you may want to consider this other option to do that. So, we want to make sure that we're a resource for our population. Even if we're not the best option, we'll be happy to say, hey, this is probably a better way to go for you, or have you considered doing this, that, or the other thing? So you can talk to one of our clinicians, just by picking up the phone or sending us an email. We have a lot of information on our website about costs and, what's involved and who we can transport, and it really answers a lot of questions. But some people just want to have a conversation, and we welcome that opportunity to just have a brief conversation about what the situation is and how we can help.
Yeah. And I will say, I know you guys have on your website also a page of videos. There's a lot of information there that's on that page that helps people really understand if they have any questions. But I agree with you. That's how I roll, is like, I just, the phone call and having the conversation, that's, that you can't get better than that, right? I want to thank you for your time, and I think that you've definitely given us clarity here, and what an important service that you offer. Again, the peace of mind to families and to the individual that you guys support traveling during such a time. I commend you guys. I'm always in awe of nurses to begin with, and this is another level, and just thank you for the service you provide.
No, Lisa, it's been a pleasure. It's been a pleasure being on your podcast, and best success to you as well.
Thank you so much, Bob. Take care.
Right. Bye-bye.
Bye. Thanks for joining me on Not Ready Yet, Curating Conversations for the Aging Journey. If something in this episode gave you clarity or the courage to start an important conversation, or offered a new way to look at things, I hope you'll share it with someone who might need the same encouragement. Remember, navigating aging isn't something we have to do alone or in crisis. With love, logic, and the right tools, we can face what's next with confidence and connection. Be sure to follow or subscribe so you never miss an episode. And if you're feeling generous, leave a review. It helps others find the show. And just a quick note, the information shared on this podcast is for educational and informational purposes only. It is not intended as a substitute for medical, psychiatric, legal, or other professional advice. Always consult a qualified professional for guidance tailored to your unique situation. This is Lisa Harper, and I'll see you in the next episode. Bye for now.